Okay, 4:31, let's get started. I'm sure there's people on the East Coast as well that are 3 hours ahead, so we'll just be mindful of time. Welcome, everyone. So thanks for joining for our webinar. We try to run these quite regularly to keep family physicians and specialists updated regarding the progress of development for some of our tools. And so one of the things that we've been working on is AI, which seems to be a big topic recently, and especially so given how there's possibility for it to save time for physicians, reduce administrative burden, and so forth. So we're excited to show you some of the tools that we've been working on. Today's speaker, I guess I'll introduce myself. I'm Andy Minhas. I'm a family physician here in BC. I have a couple of disclosures. I am a family physician. I work for Cortico. I'm the chief medical officer at Cortico Health, and I'm also an owner operator of a family practice clinic as well as a telehealth platform. To mitigate any of these, we'll primarily just be discussing Cortico features, and we'll be using Oscar EMR. We don't go over any medications or anything like that, or any pharmaceutical information. In terms of the demos that we'll be doing, these are all demo charts, so they're not real patient charts. And we're also using a demo instance of Oscar, and we're also using a beta build of Cortico. So this is not live yet, but this is more of a preview of some of the features that we'll be releasing. So some of our goals for today's session. We're going to be demonstrating the progress on two tools that we've been working on. One is the clinical summary tool, and the second one is the BC guidelines and contextual chatbot functionality. We'll be going over the pros and cons and also the benefits of them and how best to use them. We'll also be obtaining feedback later on in terms of guiding our future development for these tools. And we'll also be going over any potential obstacles that can come across when implementing technologies like this, because AI does have some limitations as well. So it's important to just discuss those and be aware of those. We'll also be investigating future applications and which directions we could go with in terms of development for some of these tools. And through discussion, we hope to also ascertain your requirements as well to learn more about how these tools fit into your practice. So the first one is a clinical summary tool. This is a tool which was primarily developed so that we could quickly gather a patient summary and so that it could be easily shared in moments of transition of care. So that includes, for example, if a patient is traveling, changing clinics, going to an emergency department, or going to see a specialist, and you quickly need to summarize their information so they have it handy with them. So the summary tool can be quite helpful, especially if you are going to be doing a chart transfer as well. The challenges right now is there's lots of unstructured chart data. So you may go to an EMR, the past medical history might not be properly filled. There might be a bunch of different encounter notes. They may not be structured appropriately, or they may have abbreviations that are difficult to understand. In addition, there's also data locking. So the information which is locked in an EMR currently, it's not useful to patients because when they go to emerge, the emergency doctors don't necessarily know what's happening. And so what we're really trying to do is work on that transition of care to make it safer for patients as well. And then the other thing that, from a technological perspective, that we're trying to solve is how do we mitigate things like hallucinations, which is one of the core challenges when it comes to AI products, and we'll be discussing that as well. In addition, privacy and security, whenever you use a typical model for large language model purposes or summarization purposes, there is the risk that that information can go into a wider training data. So what we're trying to really do is make sure that any information that is transmitted through the EMR isn't incorporated into the broader training model for services like ChatGPT. So we're trying to keep it very private as well and secure. So probably best to show off a demo. Oops. Which we can get to right after this as well. So one of our key features of this is it's secure and private. So we have an API connection with Microsoft Azure, which basically means that any information transmitted through the EMR to the OpenAI service isn't incorporated into the broader training model. We also ensure that the data residency remains in Canada. So also ensuring that none of that information is going globally or into the United States. We've also made it editable, shareable, so you'll see that in play as well. And we're also creating structure from things that typically aren't structured. And we'll talk about some later applications of that as well. So let's go through a bit of a demo. I have Oscar loaded here. So hopefully this is pretty familiar for everyone. And you may have used the Cortico plugin as well. I'll just talk through this chart. Our first chart, what I have done is I've created three demo patients and they are in order of difficulty. So this one should be the easiest patient, relatively speaking, because everything's quite organized. We have encounter notes that are well structured. We have a social history, which is in the right place, a medical history, which is in the right place. We have allergies, etc., all listed. And so what we're trying to do now is generate a summary. So I can go open my plugin. I can just click on this hamburger menu here. And then a safety notice just comes up if it's your first time using it. So a few things to keep mindful of is any AI generated content, we always want physician review, just because it's not 100% perfect, right? And so we did try to use the latest models and also fine tune them as well, which we'll discuss. And this is an ongoing process, but anything that's generated, you should always review it as well. And as always obtain appropriate patient consent. So sometimes this can be structured into your consents that is gathered at the start of a patient visit or at the start of the patient relationship. So that's also something to consider. And there's also an information link here as well, where you can click to learn more just about how our AI system works, the privacy, et cetera, and the accuracy, data residency, and their security brief. So if you ever wanted more information, that's available. So I'm just going to click I understand here. And let me just move this out of the way. I have a bar here. Okay. And so let's start with our patient summary. So what it's going to do, given that there's a token limit, which we can chat about how many encounter notes that we can process at once, we've limited it to the 100 most recent. And so what you can see here is a summary is generated. So you can see the age matches up, the sex, residence, marital status, occupation. You can see the past medical history here, past surgical history, medications as well. So you can see the pantoprazole and the naproxen, allergies, penicillin, social history, and any imaging that's mentioned. Now here, there's an important safety notice about the review required. So there is an option to edit here. So if there's anything that you want to edit, you can easily edit it here. So for example, if you wanted to add something or delete something, you can click save. And then once it's saved, you can then share it. So I can copy this, and if it's been copied to my clipboard, so I can message it to the patient if I want to. I can also email it to the patient. I can also print it. So let's show a printout here. So you can see here, there's a printable and shareable PDF, which is pretty cool. And it's organized in a clear, concise manner. So past medical history, past surgical history, medications, allergies, etc. So that was an easy chart. Let's try something a little more difficult. With demo 2, what you will see is nothing's filled. So everything's just in the encounter notes. And so we're going to ask it to parse through a bunch of different encounter notes and see what ends up happening. One thing to mention here is thus far, what we've really relied on is incorporating the chart as a whole, including encounter notes, these top bars, sidebars as well. We don't include PDFs and lab results yet, but it will pick up any lab results that are mentioned in the encounter note. These are the current limitations of it, but we are working to incorporate these two values as well. And so that'll be on a future iteration. So what you can see here, it created structure out of it. So chronic kidney disease, AFib, type 2 diabetes mellitus, hypertension, dyslipidemia, B12 deficiency, prior stroke. It's picking up things like colonoscopy, medications, allergies, social history, etc. It gives you a CHADS VAS score, interestingly, which is pretty cool. And yeah, so this has created structure out of it. Our next iteration of something that we would want to consider is allowing this to then populate the chart. So we took unstructured encounter notes, we created structure out of them, And so one of the things which we'll be working on as well in the future is allowing this information to auto-populate into the chart so you can approve it. So for example, if it says AFib, you can approve to have it added to the past medical history. So that's something in the works, but we're also trying to figure out how best to use this on a day-to-day basis as part of your workflows as well. Our next patient, so this is our most difficult patient, and here I primarily wanted to try and trick the AI. And so what I did was I put things in different fields. So I put the family history and the social history. I split up the past medical history. I put new diagnosis. So I have AFib here, and the patient's on apixaban 5 BID for it. I don't have AFib anywhere along here, so I'm going to try to see if it picks it up. I also gave it some conflicting information. So it was married in 1965, or the patient was married in 1965 and then divorced later. So let's see how it does. I also have the allergy here as well. So it's not in the right area. So summary generated successfully. You can see the AFib was picked up on apixaban 5 BID. Apixaban's picked up here as well. Let's see if it got the allergy. So correct, allergy sulfa. So pick that up as well. You can see married in 1965, divorced in 2021. So it's picking up quite good information and it's able to generate pretty good summaries. And then any labs that are mentioned in the encounter notes get mentioned here as well, and any additional notes that you may want to consider. So I can confirm this, and then I could print this. So you could give this to the patient, for example, if you need to send them to emerge, or if they're going for a trip, or even if they have to change offices for whatever reason. So just makes it really easy. So, a few things to consider when using a tool like this. Currently, models are always changing. This one uses ChatGPT 4.0, which is one of the latest models, but that'll keep advancing as well. And as it does, we'll find that we are having to update the models that it uses as well in terms of for summarization purposes. And the other thing is just be mindful of getting patient consent as well. Even though there are privacy and security implementations as part of the software that we've used, you still have to get patient consent. The other thing to consider as well is documenting in an anonymized manner. So one thing that I've started doing in my practice is I've started using PT or patient for a brief rather than mentioning names. And so that just ensures that the patient name stays out of the data, which I'm structuring in the encounter notes. The other limitations that I mentioned are is right now we're working on optical character recognition services to recognize things like the faxes or documents that are coming through so that they can then be included in the summary. And same goes for lab results as well, which is something that we'll be working on. One important consideration is a term called GIGO, or which is garbage in, garbage out. So a lot of this does require some degree of comprehensiveness in the chart. And so if your chart is messy, or if there's like too many abbreviations or stuff that only you would understand, then the AI isn't going to be particularly be able to make much use out of it. So you always want to have some comprehensive documentation. Now, this is almost getting to the point where sometimes we're finding our notes are too long with the advent of AI scribes. And so there's a bit of a balance, but just something to consider as well. And finally, I think like one thing which gives me hope is hopefully it can only get better. So what we're finding is obviously AI models are rapidly progressing as well. And so what we're finding is as we use more and more later models, we're finding it does improve and pick up any differences and use things like reasoning as well. So trying to compare and reason through its answers. One thing to also consider there as well is as the reasoning models get better, the output can get better as well. Now, we're not too certain as how quickly these advances will happen, but it is exciting nonetheless for us. One thing that we've been doing internally on the background is benchmarking different models. So we give it summaries to generate, and then we compare the outputs for different models. And so what we found was consistently 4.0 performed the best. And so that's why we're using it at the moment. The next tool that we'll be showing is the context chat. And so what we wanted to do was create a safe and secure method of communicating with an AI chatbot within your EMR. One thing that you should not be doing is copying and pasting clinical information into a LLM, especially if it's not blinded from or not having the patient information removed. And so what we really want to do is create a LLM which is accessible at the point of care and also includes some patient context and also has the safety and security that we need to use in healthcare purposes. So the key features, one of the other things that we also did was we had it reference local guidelines first. So that includes BC, Canada-wide, and then also some trustworthy sites, things like Choosing Wisely, and other best practice websites that have up-to-date clinical information. And we really wanted to align it with Canadian standards as well. So what it's trained to do is reference Canadian guidelines first. And so whenever you ask it a question, it'll include the patient context and also reference the relevant Canadian guidelines if they are available. One thing that we'd like to consider is having an ongoing reporting mechanism to have some community involvement for maintaining the guidelines and keeping them up to date as well. So if you're ever noticing that something's not up to date, feel free to flag it for us. So we'll do a bit of a demo here. So let's go to demo patient one. So let's ask it a question here. So this is the AI chat. And so what you'll see here is this is like any LLM, but what we've done is we brought it to the EMR and we have a little toggle switch here that we're including the patient context. And so just another alert here that documents and labs, we haven't included them in the clinical context. So let's see, this patient has dyslipidemia. So let's ask a question. So this patient or let me rephrase it. So, does this patient require a statin? So let's ask a question. So you can see here the answers come up and you can see there's guidelines found as well. And so key medical history conditions, so dyslipidemia, no documented cardiovascular disease. There is a family history of stroke with a father with hypertension and CVA. And then you can also look at current risk factors. So it's picking up things as well relevant, BC guidelines. So what are the BC guidelines? It mentions them, tells you to calculate Framingham risk, etc. Now here it actually asks you to order a lipid panel because right now we haven't incorporated labs, but I could tell it labs. So one thing, for example, I could do is this patient had a blood pressure of 160 over 90 and a LDL of 4.5, HDL 0.8. What do you recommend? And so you'll see a response come up here as well. And so assess cardiovascular disease. And so we have some Framingham calculations here as well. It gives you the risk score. It pulls up the relative guidelines as well. One thing that's pretty cool here is we have a copy button. So you can copy the output as well. So if you want to paste it into your chart. And then you can see here, if I reference or click guidelines here, it'll open the relevant guidelines. So click to open PDF. And so you can see things like hypertension guidelines and whatever's been referenced there come up. And so these are BC guidelines. And so it's picking up the relevant cardiovascular disease prevention guidelines and referencing them. Let's try something else. So let's try demo 3. So if you can remember, this is a 85-year-old patient. They have CKD stage 4, AFib, they're on a DOAC. So let's ask it if we're on the right dosing. Oh, sorry, I have to rerun that because I didn't include patient context. So sorry, let me try if I can redo that. Is this patient the correct dose for Pixaban? So based on the patient's clinical profile, may need reassessment due to CKD stage 4. And so renal function, age, and weight. And so the patient's meeting two of the following criteria, so age and CKD. And so consider reducing the dose. So that's pretty cool. It also gave us some context-aware information as well. Let's ask another question. Now, this patient has a sulfa allergy, right? So we haven't told it that. So let's try to see if we ask it, the patient gets cellulitis. So this patient has MRSA cellulitis. Which antibiotic should I consider using? And what's really cool here is it picked up that the patient has reduced renal function and a sulfa allergy. So it's going to give relevant information as well. So preferred for MRSA cellulitis, etc. And so you can see here how adding that patient context enriches the AI functionality of the large language model chat and also does it in a secure and safe way as well. So this is one of the other or the second features that we're hoping to roll out soon. So just time for a brief discussion. If there's any questions here, happy to answer them. Oops. Um,
We have a question from Maggie. Can you use the chat to just search through the chart without giving clinical recommendations? For example, please summarize patient's history of psychiatric medication use, like what has been tried and when.
oh, good question. We haven't tried that. Maybe we can try it live. I'm not sure how it'll work, but I'm happy to try it. Let's do it. So maybe what was the request there?
To summarize the patient's history of psychiatric medication use, like what has been tried and when.
Okay, so maybe let's try something relevant for this patient because I don't know if they have psych or actually anxiety. So sure. So let's see here. Please summarize this patient's past medication trials for anxiety and mental health. Certainly, based on the provided notes, here's the summary of the past medication trial. So we picked up mirtazapine. I wonder if mirtazapine's the only one. Maybe we can quickly look. So I see it there. Um, abdopain, viral gastro, diabetes, asthma, obesity, anxiety, low dose mirtazapine. So yeah, right now, yeah, it's pretty cool. So yeah, it did pick that up. Keep in mind, it only scans back 100 encounter notes, and that's because there is a token limit. So tokens basically refer to a series of words. And so usually, sorry, letters, I should say, or characters. So a series of 2 to 3 characters usually is one token. And there's a limit to how many tokens that we're able to transmit at once to the model. And so because of that, we're only able to go back 100 encounter notes currently.
Annie, there's another question. Can I edit my own templates on the go? Uh, I believe it's probably referring to the IPS summaries.
Not at the moment. It is certainly a feature that we could work on. That would be helpful, actually. So then what I'm understanding is then you could rearrange or reorganize the information or even remove some of it. So, for example, if you wanted to not include past surgical history or remove or add certain methods. That is something that we could work on, but that's a great idea. That's something I'll write down actually. Um, well, editable IPS sections. Okay, cool. Um, any other questions, Alfred?
There's a follow-up question from Maggie. Can you tell it to scan through certain years specifically to limit the encounters?
Not at the moment, right now. Well, I'm just trying to think how that would work. As well, I could probably tell it to go back within the past 100 encounter notes. I'm not sure if I could tell it to go back within a certain year. That is something, again, I think like that's probably something that we could totally work on. That'd be pretty good actually, because then we could ask it to include only certain relevant years. That being said, it does scan kind of the entire chart to then find those years, so there is a bit of a limitation there. But like if like for example within the past 100 notes that did encompass that year, then it would pick it up. But if like the past 100 notes only went back to, for example, 2023, and then you asked it to search 2018, I haven't come across it being able to do that yet. But it is certainly a good consideration because I guess we would want it to summarize very specific periods of the patient's health at times as well.
And the limitation really is also to do with the fact that this is a beta feature. So a lot of
Yeah.
testing currently.
We've been trying to break it a bit, and we found it broke around the 150 encounter note limit, and at least for some of the beta charts that we made or the demo charts that we made, that typically went back a number of years. What might make it more challenging is the current notes seem to be a little longer with the advent of AI scribes. And so there is a bit of a limit. And now the token limit is always going up as well. So we're hoping that over time we can incorporate more tokens, which would in turn mean more data that can be summarized. But right now we're limited to that. I believe it's around 50,000 tokens per request. Any other questions, Alfred?
Just a comment from Maggie as a follow-up. She was thinking that it was potentially a workaround to the limit of the 100 encounters that it could read through.
Yeah, certainly by giving it like years to scan through, it's certainly a consideration. We could consider developing it on a future iteration. Right now, we were really focused on just getting it working and working well and safely. And so, certainly, I think that's a fantastic suggestion, and we can take that into consideration for future iteration.
Question from Bridget. Does it scan the consults?
At the moment, no. So that's a different type of technology called OCR or optical character recognition. So that what that does is it scans through like a document or a PDF because that's not necessarily text or digitized information already. So it's typically like a PDF that you need to scan and then parse and pull information from. And so that's going to be the next phase as well, is having that technology incorporated into it. So, but that would be very useful, certainly, because then we could pull information from heaps of PDFs. So, like, you could probably feed it then like 300 PDF pages, and then it would create a summary for you. So there is a lot of utility there. Right now, we don't have that OCR level technology yet, but it is version 2. So we're working hard on that as well.
Thank you, Andy. It looks like we don't have any more questions, but I really want to have a couple comments. If anyone is interested to help advise or test out these AI features, please do let us know. I put our email in the chat, solutions@cortico.health, or you can go to a website at cortico.health to reach out to us. And if there's any other tools that you guys have used that are similar, we'll love to have feedback on how we can improve ours.
Certainly. And just to also finalize or add on to that as well, we're hoping to release this within the next 2 weeks or so. One thing which we're working on right now actively is storage. So right now, what you may have noticed is I'm generating summaries from scratch each time. What we're trying to do before we release it as well is create a safety storage. So you could then go back a week later and see what was generated, or you could go back a month later and see what kind of conversation or chat that you had. So it's important just for record keeping purposes. So we're working on saving that. So that'll be coming out. And the other thing is, once it does come out, we will announce it, but it'll be off by default. So if you do want to have it on, just reach out to us and let us know. So then we can turn it on for either yourself or your clinic.
Thank you, Andy. There's two questions that came through while we were speaking. One is a follow-up question from Maggie. When the AI tool is reading through parts of the CPP on Oscar, like PMIC checks and RX, does it read through all the archived data too?
In terms of the archive, good question. I'm not certain at the moment. As far as I'm aware, it's active, like active medications or active encounter notes. I haven't tested it on archived yet, so I'd have to test that out.
Thank you. Another question from Patrick. What's the vision of the end product of Cortico? I'll try to attempt to answer that. I probably won't go into too much detail because it does probably take quite a long period of time just to explain our strategy. But at the end of the day, the goal of Cortico is to make all the modern features available to clinicians from the comfort of their EMR. And to be able to facilitate the communication with patients from the EMR. And so any products or features or services that relate to that is what Cortico wants to be working on over the next 5 years.
There's also AI is pretty hype, and it's easy to get lost in a lot of the hype right now. What we're trying to do is release it safely and securely. There's also a lot of different AI tools coming out, and so our focus has mainly been on stuff that saves either administrative burden or helps automate clinical workflows. And so that's kind of one of our main focuses is really trying to find tools which do those things. And so what we're trying to solve is a lot of like the administrative burden crises through things like automation. The the AI tools as well, there's been a lot of concerns about things like hallucinations. Now what we're seeing is like through fine tuning, what we can do is adjust things like it's called like top P. We can also adjust something called temperature. And so these two models can be tuned to basically limit things like hallucinations or creativeness, so to say, of the model. And so that's one thing to consider. Benchmarking, also comparing it to other models as well. The models as they stand aren't perfect, but what we're finding is increasingly they're becoming more and more useful in a clinical setting as well. And so keeping them up to date is always really important. So just to answer your question, yeah, like what Alfred mentioned as well, we're trying to do it safely, securely, and then also work on automating your workflows so that you have more time for either yourself or your patients or your practice, and really reduce a lot of that time that you spend just doing admin stuff. One interesting thing I should also mention as well, sorry, is uh, I was at a talk recently and they mentioned that previously there was more concerns about hallucinations. Now, when it comes to larger data sets like this, it's more of a concern as did it capture everything? And so because there's so much information, and if you consider like for example like a 400-page chart and you're trying to ask it to generate a 2 or 3 page summary, and so the concern not doesn't necessarily well, yes, you should always check for hallucinations, but also the main thing is like, did it get everything? So that's one of the main things that we're trying to focus on as well.
Great, thank you, Andy. We're at 5:05, so we're a bit over time. Perhaps I'll use this opportunity to thank everyone for coming out to the webinar. This webinar is recorded, and we will be making the recording shortly. over the next couple of days. So if you have any colleagues that you feel might be interested to learn about this tool, feel free to share it at that time. Thank you so much, everyone, and thank you, Andy, for sharing this tool.
Thank you. Thanks, everyone.
Thank you, everyone. Have a great night.